need to tell you about something that happened in my clinic 3 months ago that completely changed how I think about natural circulation support.
A 74-year-old patient came to see me. She'd been drinking beet juice every single day for 6 months, religiously, never missed a day, because her cardiologist had recommended it for her blood pressure. And she was frustrated because while it had helped a little, the results weren't nearly as dramatic as she'd hoped. Her blood pressure had dropped maybe 3 or 4 points. She felt slightly more energetic, but nothing close to the transformation she'd read about in the studies. I asked her one simple question. Are you adding anything to your beet juice or drinking it plain? She looked at me confused and said, plain. Should I be adding something?
That's when I told her about a single ingredient, something sitting in a refrigerator right now, that when combined with beet juice creates what researchers
call a synergistic amplification effect on blood flow. Not just a small boost, a documented doubling of the nitric oxide response in some studies. She started adding it the very next day. 6 weeks later, her systolic pressure had dropped an additional 9 points. She told me she had energy she hadn't felt in years. And her husband noticed that the chronic coldness in her hands and feet, something that had bothered her for over a decade, had virtually disappeared.
One ingredient costs less than $1, and it unlocks the full potential of what beet juice can actually do for your circulation. Today, I'm going to tell you exactly what that ingredient is, why it works at the molecular level, and how you can start using this combination tonight to support blood flow to your heart, your brain, your legs, and every organ in your body that depends on healthy circulation. My name is Dr. Billy. I'm a medical doctor with 14 years of clinical experience, and I've spent a significant portion of my career focused on cardiovascular health in patients over 60.
Everything I share with you today is backed by published research, clinical outcomes, and real results I've seen in my own practice. Stay with me through this entire video, because what I'm about to explain could genuinely change the trajectory of your vascular health.
Let me be direct with you about something most doctors don't explain clearly enough. After you turn 60, your molecule that tells your blood vessels to relax and open wide declines dramatically.
The inner lining of your arteries, called the endothelium, becomes less responsive. It's been battered by decades of oxidative stress, inflammation, blood sugar fluctuations, and simply the wear and tear of time. And as endothelial function declines, so does your circulation. This isn't cosmetic. This isn't about vanity. When blood flow to your brain decreases, your risk of memory loss, cognitive decline, and stroke increases. When blood flow to your heart decreases, your risk of chest pain, heart attack, and heart failure goes up. When blood flow to your legs diminishes, you experience fatigue, pain with walking, and loss of the mobility that keeps you independent. And here's the statistic that haunts me as a physician. According to the American Heart Association, more than 50% of adults over 60 already have measurable endothelial dysfunction, meaning their blood vessels have lost a significant ability to dilate properly in response to the body's needs.
Most of these people have no idea this is happening. There are no symptoms in the early stages, no warning signs, just a silent
progressive loss of circulatory capacity that sets the stage for every major age-related disease. The conventional medical approach is to wait until blood pressure climbs high enough to require medication, or until a cardiac event forces intervention. But by that point, you've already lost years of optimal blood flow to your most vital organs. I don't accept that approach. I believe in meeting your cardiovascular system where it is right now and giving it the support it needs to function at the highest level possible, naturally, safely, and based on solid science. And that's exactly what beet juice does, especially when you combine it with the one ingredient that makes it twice as effective. Let me walk you through exactly what happens inside your body when you drink beet juice, because once you understand this pathway, the importance of the addition I'm about to reveal will make perfect sense. Beets contain exceptionally high levels of something called dietary nitrates. These are naturally occurring compounds, not the synthetic nitrates added to processed meats, but healthy plant-based nitrates that your body can use to produce nitric oxide. When you drink beet juice, those nitrates are absorbed into your bloodstream, but they don't go straight to work. They need to be converted first. And here's where the process gets fascinating. The conversion begins in your mouth, specifically on the surface of your tongue. You have bacteria living there that possess special enzymes capable of transforming nitrates into nitrites. This is the critical first step, and without it, the entire pathway stalls. Once those nitrites are formed and swallowed, they travel down into your stomach. This is where the environment becomes crucial. In the acidic conditions of your stomach, nitrites begin converting into nitric oxide. Additional conversion happens in your bloodstream and directly within the walls of your blood vessels, where enzymes and chemical conditions finish the transformation. The end result is nitric oxide, the most important signaling molecule for blood flow in your entire body.
Here's what nitric oxide does. When it's released near the smooth muscle cells surrounding your arteries, it activates an enzyme
Called guanylate cyclase. That enzyme produces a secondary messenger called cyclic GMP. And cyclic GMP delivers a simple but powerful command to those smooth muscle cells. Relax. When they relax, your blood vessels widen. Resistance drops. Blood flows more freely. And every tissue in your body, your heart, your brain, your kidneys, your muscles, receives more oxygen and nutrients. Now here's why this matters so much for people over 60. Your endothelial cells, those cells lining your arteries, normally produce nitric oxide through an enzyme called endothelial nitric oxide synthase. But that's the pathway that breaks down with age. Inflammation damages it. High blood sugar impairs it. Cholesterol clogs it. And by the time you're in your 60s or 70s, that endothelial pathway is operating at maybe 50 or 60% of its youthful capacity. Beet juice doesn't depend on that pathway at all. The nitrate to nitric oxide conversion I just described bypasses your endothelium completely. It works regardless of how damaged your endothelial function has become. It gives your body an alternate route to produce the nitric oxide it desperately needs, but can no longer generate efficiently through the aging endothelium. That's why study after study, from institutions like Wake Forest University, the University of Exeter, and others, has shown that beet juice can lower blood pressure by 4 to 10 points, improve exercise capacity, enhance blood flow to working muscles, and increase flow-mediated dilation, which is the gold standard test for vascular health. And these effects start within 2 to 3 hours of drinking it and can last for up to 24 hours. Write this down.
Beet juice works because it provides a backup pathway for nitric oxide production that doesn't rely on your aging arteries to do the heavy lifting.
Now let's talk about the ingredient that amplifies everything I just described. That ingredient is fresh lemon juice. And here's why it's so powerful. Remember when I told you that nitrites convert into nitric oxide in your stomach? That conversion is heavily dependent on acidity. The more acidic your stomach environment, the more complete and efficient that conversion becomes. In a strongly acidic environment, nearly all of the nitrites are transformed into active nitric oxide.
But if your stomach isn't acidic enough, and many people over 60 have reduced stomach acid due to aging, medications like proton pump inhibitors or H. pylori infections, a large portion of those nitrites pass through unconverted. You're essentially wasting the potential of your beet juice.
This is where fresh lemon juice changes everything. Lemon juice is loaded with citric acid. When you add it to your beet juice and drink the combination, you're pre-acidifying the mixture before it even reaches your stomach. This creates ideal conditions for maximum nitrite to nitric oxide conversion. A study published in Free Radical Biology and Medicine demonstrated that acidic conditions can increase the conversion efficiency by as much as 2 to 3 times compared to neutral pH environments. That means you can potentially double or even triple the amount of nitric oxide your body generates from the exact same amount of beet juice just by adding lemon. But there's a second mechanism at work here that's equally important. Lemon juice provides a concentrated dose of vitamin C, also called ascorbic acid. And vitamin C doesn't just acidify the environment. It actively participates in the chemical reaction that turns nitrites into nitric oxide.
Vitamin C acts as what's called a reducing agent, explained clearly enough. It donates electrons that push the conversion reaction forward to relax, essentially acting as a catalyst.
Research published in the British Journal of Nutrition has shown that vitamin C enhances nitric oxide production from dietary nitrites in a dose-dependent way. The more vitamin C you have present, the more nitric oxide gets produced. And vitamin C does 3 additional things that protect and extend the benefits of beet juice.
The first, it's essential for collagen synthesis, which keeps your blood vessel walls strong and flexible. The second, it protects nitric oxide molecules from being destroyed by free radicals.
Nitric oxide is fragile and breaks down quickly when exposed to oxidative stress. Vitamin C shields it, extending its functional life inside your bloodstream.
The third, vitamin C helps regenerate tetrahydrobiopterin, a compound required by your endothelial nitric oxide synthase enzyme.
So even though beet juice bypasses the endothelial pathway, vitamin C helps keep that pathway functional too, giving you dual sources of nitric oxide working simultaneously. This is true synergy, not just adding one benefit on top of another, but creating a multiplied effect where the whole is genuinely greater than the sum of the parts. To use this combination, here's what you do. Take approximately 200 to 250 milliliters of beet juice, that's about 1 cup, and squeeze in the juice of 1 full fresh lemon. Stir it well and drink it. The tartness of the lemon actually balances the earthy sweetness of the beet juice beautifully. Most people tell me it tastes far better than plain beet juice. Before I go any further, let me ask you something. Are you getting value from this video? If the answer is yes, I need you to subscribe to this channel right now. I put out a new video every single week on evidence-based health strategies specifically designed for people over 60. Heart health, brain health, diabetes, joint pain, sleep, all of it. This is the kind of information that can add years to your life and life to your years. Hit subscribe. It's free, and it makes sure you don't miss what's coming next. Let me tell you about Margaret. That's the patient I mentioned at the beginning of this video. Margaret was 74 when she first came to my office. She'd been dealing with high blood pressure for 12 years. She was on 2 medications, and her systolic pressure was still sitting in the high 140s to low 150s despite being compliant with everything her cardiologist prescribed. She'd also been experiencing what she described as bone-deep fatigue every afternoon, and her hands and feet were constantly cold, even in the middle of summer. Her husband joked that it was like sleeping next to an ice pack. Her cardiologist had mentioned beet juice as a complementary strategy, so she'd been drinking 8 ounces every morning for 6 months. She saw a small improvement, maybe 3 or 4 points on her systolic pressure, but nothing close to what the research suggested was possible. When I asked if she was adding anything to it, she looked at me like I'd asked a strange question. "No," she said. "Should I be?"
I explained the chemistry I just walked you through, the role of stomach acid, the catalytic effect of vitamin C, the protection of nitric oxide from oxidative breakdown.
I told her to add the juice of 1 fresh lemon to her beet juice every morning and keep everything else the same. 6 weeks later, she came back for a follow-up. Her systolic blood pressure had dropped from 148 to 131. Her diastolic had come down as well. But what struck me most was the look on her face. "Dr. Billy," she said, "I feel like I have my energy back. I'm not falling asleep in my chair at 2 in the afternoon anymore. And my hands, look." She held them out. "They're warm. My husband noticed it before I did." That's what happens when you restore circulation. It's not just numbers on a monitor. It's warmth in your extremities. It's mental clarity. It's the energy to do the things you love without feeling like you're dragging a weight behind you. Margaret kept the practice up. A year later, her doctor reduced one of her blood pressure medications. Her flow-mediated dilation, a measure of how well her arteries respond to increased demand, improved by 18%. And it started with 1 ingredient added to a glass of beet juice. Here's exactly what I want you to do starting tonight. The first thing, get high-quality beet juice. You can juice fresh organic beet yourself if you have a juicer, or purchase pure organic beet juice without added sugars, apple juice, or preservatives. Look for it in glass bottles or in the refrigerated section. Read the label. It should say 1 ingredient, beets. The second thing, add the juice of 1 whole fresh lemon to about 1 cup of beet juice. Use fresh lemon, not the bottled stuff. Fresh lemon contains the full spectrum of citric acid, vitamin C, and bioflavonoids that make this combination work. The third thing, drink this once a day, every day. You can drink it in the morning to support circulation during your active hours, or in the evening to provide nitric oxide during the overnight window when your cardiovascular system does most of its repair work. Try both and see what feels best for you.
The fourth thing, be consistent. You'll feel acute effects, better energy, warmer hands and feet within days. But the long-term improvements in blood pressure, vascular flexibility, and endothelial health build over weeks and months. Make this a non-negotiable part of your daily routine. The fifth thing,
Protect the bacteria on your tongue. Do not use antibacterial mouthwash right before or after drinking your beet juice. Those bacteria are essential for converting nitrates into nitrites. Regular toothpaste is fine, but skip the antiseptic rinses around the time you consume beet juice. And one final thing, if you're on blood pressure medication, do not stop taking it. This is not a replacement for your prescriptions. It's a complement. But monitor your blood pressure regularly, and if it starts coming down consistently, talk to your doctor about potentially adjusting your medication dosage under their supervision. That's what happened with Margaret, and it can happen for you too. Your circulation is everything. It determines how well your brain functions, how strong your heart beats, how far you can walk without pain, how quickly you heal, how independent you remain as the years go on. After 60, time is not on our side when it comes to vascular health. But that doesn't mean you're helpless. The combination of beet juice and fresh lemon juice gives you a proven, research-backed way to support nitric oxide production, open your blood vessels, and protect the circulation that keeps you alive and thriving.
I want to hear from you. Have you tried beet juice before? Did it work for you, or were you disappointed with the results? Are you going to add lemon now that you understand the science? Leave a comment and let me know.
If this video helped you, I need you to share it. Send it to someone you care about, a spouse, a parent, a friend, someone who's dealing with high blood pressure, cold hands and feet, or just wants to protect their heart and brain as they age. Sharing this could genuinely change their life. And if you haven't subscribed, do it now. I release a new video every week on practical, evidence-based health strategies for people over 60. Next week, I'm covering the one mineral deficiency that's silently destroying bone density after 60, and a surprising food that fixes it. You don't want to miss it. Everything I've shared today is general medical information based on published research and my 14 years of clinical experience. This is not personal medical advice. Always consult your own physician before making changes to your health routine, especially if you're on medications or managing chronic conditions. Thank you for watching. Protect your circulation, and I'll see you next week.